should explain what this is. This is a result of renal calculi, which is also known as kidney stones. Renal means kidney. So when you hear someone say renal, adrenal glands, which is adjacent to renal, or renal failure is kidney failure. Renal clonic is like the pain caused by renal calculi, kidney stones. So kidney stones is signs and symptoms. Could be intense proximity lumbar pain, pain radiation to the abdomen, the bladder, the genitals, and in the inner thighs, nausea and vomiting, diarrhea, abdominal discomfort, tachycardia, urinary urgency, and hematuria, which we talked about before, is blood in the HAE, or hema usually means blood. Okay, so then we have treatment, which would be hydrate abundantly, filtrate the urine, monitor for hematuria and pyuria, which is burning during urination, follow the prescribed diet, alkaline or acidic, administer medications that reduce the uric acid, suggest they take hot baths, the patient takes a hot bath, and in case of the attack, a renal clonic attack, administer the medications such as narcotics or antispasmodics if necessary. Alright, so if kidney stones are not passed through the urinary tract, they can also be destroyed in two ways. They can be taken out by surgery or external corporeal lithography. Then we have urinary incontinence, which is the difficulty in controlling urination. Incontinent urination. The causes could be obstructional injury, post-operative complication, malformation, menopause, neurological disorder, or a inflammation of the bladder or the urethra. Okay, so there's two different types. There's stress incontinence and urge incontinence. Stress incontinence risk factor could be childbirth or multiple pregnancies, estrogen deficiency, usually menopause, chronic cough, or chronic constipation. Then we have the urge incontinence, which risk factors may be caused by cerebral or psychiatric, neurological, or geriatric pathologies. Okay, so then we have neurogenic bladder, which is a term that includes bladder dysfunctions that lessen due to the nervous system. So there's two different types. We have spastic and flaccid form. Spastic is the loss of sensitivity and motor control reduced by the bladder's captivity, significant in hypertrophy of the bladder walls, little or no conscious control of the bladder and activity, and emptying reflex. Flaccid form is the bladder fills up and descends excessively, causing damage to its muscular structure vessel. Muscle contracts weakly. There may be a loss of sensitivity, but the patient does not suffer any discomfort. The treatment is teach the patient how to self-catheterize, perform intermediate catheterization, specific intervals from 4, 6 to 8 hours, depending on hydration. Monitor fluid intake and output. Follow urination timeline, encourage hydration, encourage mobilization, and provide a low calcium diet. And then we have endometritis, which is the inflammation of the endometrium. Signs and symptoms are pelvic pain, hypothermia, leukorrhea, and metrorrhgia. Treatment is administer prescribed medications, record the appearance of discharge, record signs of pain, and check temperature regularly. Then we have mastectomy, which, if you do not know if there is a tumor or cancerous or benign tumor in the breast, then this is the removal. Mastectomy means the removal of the breast, with or without the removal of the axillary lymph nodes. Okay, so post-op treatment, after the surgery has been done, post-operations, after the operation, we could administer medication, monitor vital signs, monitor discharge through the drain in the incision, monitor discharge in the dressing. Oh, excuse me, so tired. Help the patient perform respiratory exercises, have the patient get up as soon as possible, place the patient in a half-seated position with the arm on the operated side supported on a higher pillow. Begin exercises on the operated side as soon as possible, and avoid compressing on the affected side. So avoid using maybe a blood pressure cuff on that side. Okay? Prolapse is the descendant of the uterus into the vaginal cavity, sometimes bringing the vaginal bladder and rectal walls with it. Okay, so signs and symptoms are pelvic heaviness, lower back pain, stress incontinence, polyuria, urinary urgency, repeated cystis, constipation, fecal gas incontinence. So now I'm going to talk about, there's a lot of medications that I've brought up, but the main things I want to talk about today are diuretics and prescribed hormones. So first we're going to start with diuretics. So diuretics they're prescribed to increase urine output in order to decrease blood volume and edema. Okay, so the side effects are reduction of blood volume may cause increased thirst, drowsiness, fatigue, orthostatic hypotension, which is you know when you sit up too fast and you get really lightheaded, that's orthostatic hypotension. Then we have dehydration. Variations in blood potassium may cause weakness, pain and muscle cramps, weak and irregular pulse, distress, irritability. Gastrointestinal problems may cause anorexia, diarrhea, and vomiting. Then we're going to skip right to reproductive hormones. Hormones may be administered to provide contraception, such as birth control, or inhibiting ovulation. So the side effects are breast tenderness, nausea and vomiting, vaginal bleeding, weight gain or loss, edema of the ankles and feet, a rash, and headache. And that in total consists of my summary of Urinary and Reproductive Systems, Module 16 of the Cemeq. I hope you enjoyed it.